Dr. Bonnie Jones, and I'm co-owner of the Delphos Animal Hospital and have been for almost 32 years. I love what I do on a daily basis, and I want to share with you just exactly what that is. I am a small animal practitioner, which means I see predominantly pets. My husband and co-owner does also take care of large animals, and he's called a mixed animal practitioner. So our services here are to provide medical and surgical care for animals big and small. And I want to tell you a little bit about how I got to where I am today. I started off thinking that I wanted to be a nurse. So I actually volunteered at my local hospital, worked my way up from the flower shop to the beverage counter to the floors where I got to actually see nursing care. And that is probably one of the best things I ever did, because from that experience I realized I don't want to be a nurse. I really loved medicine. I loved biology, the sciences and math and numbers. And so with my love of animals and my love of medicine and having had that experience in the hospital, I thought, you know what, I need to check out a career in veterinary medicine. So my next step was to actually find out what the school requirements would be. It does involve a lot of education. On average, veterinarians will have at least 8 years of education before they actually graduate from the veterinary college. But prior to that, we are tasked with getting experience by shadowing in veterinary hospitals, or even working if there's a job available. But shadowing goes a long way because you can actually see what goes on in that career field. So I guess my advice to anybody interested in veterinary medicine is get your foot in the door at a hospital and see what the doctors actually do. It's a lot of communications between pet owners and doctors. It's hands-on with pets, which is the fun part. And it's also exposure to business education. So we're looking for well-rounded individuals who have interest not just in the animals, but in people. Again, I can't emphasize enough, what we do is a lot of communications. The college training itself, there is a set of pre-veterinary requirements that you do have to complete. It's strong emphasis on science and math, of course, but also the humanities, knowing how to communicate and to be with others as a member of the public. So I always emphasize to students that I am mentoring that you need to seek outside community activities, get involved, and be a leader in your community. Yes, you have to study very hard, but you do need to be well-rounded. And then when it comes time to graduate from vet school, you will be prepared to enter a field that will be challenging and fun. I would say to you, what I look for in veterinarians that will work for me is, again, that individual who has awesome communication skills, who really has that compassionate, caring personality, who likes the science of what we do as much as the medicine. So again, just emphasize being a good student throughout your high school career and carry that right over into your college education as well. So I also want to tell you a little bit about what a typical day at Delphos Animal Hospital would be. We do both medical and surgical services, so with multiple doctors on our staff, one doctor will actually be doing what we call our outpatient services, where that doctor is taking care of sick animals or doing preventive health care, such as vaccinating and heartworm testing. The other doctor then is doing surgery, and that can be routine surgeries or surgeries that come out of injury or illness. We are not doctors working alone. We do have a support staff too. We have client care specialists, who are the people that you will meet and greet when you come in the building or when you call. These people are integral to making our operations run smoothly. And then there's our technical staff, our veterinary assistants and our veterinary technicians, who assist the doctors in preparing the patients for their outpatient visits or in the surgery room. So we are a team. We work together providing medical and surgical services. Some of what we do does involve euthanasias, which is putting animals to death humanely, but that is an opportunity to actually stop suffering and to relieve pain. So that is part of our job as well. I'd also like to talk about the fact that our profession has become a female-dominated profession. And so we see a trend where women are the majority and they want to still have a family life as well. So traditionally we would be practice owners and male and female, but now we're seeing maybe more of a part-time job by these women who are still trying to balance families as well. So I would say that the graduating classes are now probably 85% women. And I mean, that's a little bit disappointing. I'd love to see more men in the profession, but that is the reality. And then there comes the advancement in veterinary medicine. I have seen over the 3 decades a huge change in how we do what we do. From our x-ray equipment, which was traditional film and hand dipping tanks, to now digital radiography, where we have everything computerized and our images come up on a computer. We have moved from paper records to all of our information being stored on a computer and generating drug labels off of label printers. We have ultrasound equipment now. Our hand scaling of teeth has grown into ultrasonic sophisticated dental equipment. So there is really not an area where we have not been impacted by the advances in technology. When I'm looking for an individual to join my team, I am looking for somebody who anticipates needs and is a quick learner. It does take a high level of intelligence to do some of the science and medicine that we do, and that's reflected in the education that's required for veterinary medicine. But I also look for employees that are people-oriented, that really enjoy working with people. The pets don't come in the door by themselves, so we are caring for people as much as we are caring for pets. So in our profession, we also have different job options. Veterinary technicians are instrumental to what we do in the animal hospital environment. Veterinary technicians graduate from anywhere from an 18-month to 3-year program that is designed to make them essentially a nurse for a veterinarian. So technicians are skilled at things like venipuncture or blood draws. They can induce pets under anesthesia, give injections. The only things they can't do that a veterinarian does is to prescribe, diagnose, or do surgery. So they really are very hands-on, and they are so important to the veterinarians. A veterinary assistant doesn't have the technical degree necessarily, and doesn't necessarily do the venipunctures and the anesthetic inductions, but they can be employees that are trained on the job to actually assist the technicians with animal restraint, preparing medications, things that don't require licensure like a veterinary technical degree would. Veterinarians, on the other hand, our education starts with completing what are called pre-veterinary requirements. And then you do have to take a standardized test, a pre-veterinary test, and you go through an interview process after you've completed all the educational requirements. So students who are considering becoming veterinarians need to have a strong self-dedication or motivation character. They need to be prepared to study very hard, science and math being a large part of it, but also your English skills and being able to verbally and in writing communicate with others. So you need to be a well-rounded individual who is really quite intelligent, very determined, and very motivated at succeeding.
My name is Dr. Jill Dental, and I'm an associate veterinarian here at Delphos Animal Hospital, where we focus primarily on companion animal medicine, cats, dogs, and some other small animals, as well as the occasional large animal, horse, cow that wanders in. I am a recent graduate of The Ohio State University, graduating in May of 2012. Prior to attending Ohio State for 4 years of veterinary school, I attended the University of Findlay, where I graduated with a bachelor's in biology and a bachelor's in animal science, as well as a minor in chemistry. One of the most helpful things I would recommend for a high school student to do in their education is to take as many different science classes as you can if you are seriously considering the field of veterinary medicine. It is a wonderful field, but it is a very difficult journey to go on. The undergraduate coursework is very difficult. There's a lot of science classes involved, genetics, biology, microbiology, many different levels of anatomy that you're required to take. So getting a good foundation in high school in the sciences would definitely help you. Veterinary school was also a lot of work, also again science-based. We start off with a lot of anatomy and then build from there, focusing on different branches of medicine. Everything from focusing on the heart and cardiology to the respiratory system to kidneys, and just kind of work our way through various species, learning the different parts of the anatomy as well as how we treat various conditions, what's normal, what isn't normal. What I probably enjoy most about my job is getting to work with animals. I've always loved animals. However, this field is not one that you should enter specifically for that love. There's a huge component of my day that involves working with people. I enjoy working with our clients very, very much and helping them meet their goals with their animals, which is fixing whatever medical issue they present with or concern. A typical day for us usually starts a little after 8 in the morning. We arrive, go through any charts or messages that we had left from the day before, check our fax machine for any emergencies that would have come in overnight from the emergency hospital. We do see some emergency ourselves, but more severe emergencies we do refer to a local hospital. We open up at 8:30 and it depends on the day, but we'll either head to surgery that morning and check in our surgery patients, or different mornings we'll see outpatients. The doctors switch back and forth. So we'll work throughout the morning either doing routine surgeries, dental cleanings, spays and neuters, mass removals, and some other small procedures here in our hospital. Or we sit and we see outpatients in the morning, vaccination type appointments, animals that are sick, other appointments, we'll work through that in the morning. Lunch usually starts anywhere between 12:30 and 1 for us. We use that opportunity to get something to eat, walk our own animals. We check messages, catch up on charting from the morning, take care of anything that we need to do, and then we start back in at 1:30. 1:30 we see appointments all afternoon, and that ranges any small animals that are scheduled to large animals, or any emergencies that happen to wander in, and we close at 5:30. We usually end up staying quite a bit past 5:30 to catch up on paperwork, take time to call our clients with any blood work results that we get and answer any of their concerns before we finally head home for the evening.
Hi, my name is Danielle Cordycrax. I'm a veterinary technician student from Brown Mackie College. I actually have 2 months left, and then I start my externship here at Delphos Animal Hospital, and I graduate in June. Things going into college that I wish I would have known in high school was to start with a good study ethic. That was the biggest thing. I never really studied in high school, and that really hit me hard in college, not studying very well. And just really focus on what you want to do when you graduate. I come here to shout out to requirement with my college, and I get to watch Dr. Bonnie, Dr. John, and other techs perform jobs that I'm going to be performing when I go on externship, like blood draws and vaccinations and running tests. I really enjoy coming here. It's a really nice clinic.